Gupta. I'm a senior consultant obstetrics and gynecology at the Miracles Apollo Cradle Spectra Hospital, Sector 82, Gurugram. So this is a new hospital that has come up in the Sector 82 of Gurgaon city. It's a multi-speciality hospital. We have all the surgical specialties. We have excellent modular OTs and an ICU backup. So it's an excellent facility for the people of New Gurgaon. And now coming straight to the topic that we are going to talk about today. It is about pregnancy in the times of COVID. So the second wave of the COVID-19 has taken over all of us like it came like a tornado, and almost every family has got affected by the effects of this very, very severe second wave of COVID-19. Pregnancy in times of COVID has has brought forth many challenges, not just for the pregnant patients but also for the obstetricians and the gynecologists. So I'll be talking about pregnancy in the COVID times today. I would request the audience to please put your queries and questions in the chat box, and I'll try to address all of them one by one, and we'll try to make this session a fruitful and interactive one. So coming to the first situation, a lady gets pregnant or she is pregnant in the ongoing pandemic, then what care she needs to take? So first and foremost, it is very important that stay home. So, it is more of a self-imposed lockdown. It is all about self-governance. Everyone is responsible for their own health. So please do not try to, go out of the house unless it is absolutely necessary. Stay at home. If you're going out of the house, wear an N95 mask. I would request all pregnant ladies to wear an N95 mask if they're going out of their house, and not just the usual cotton masks, because definitely the N95 masks will they provide more greater protection. Double masking is something which has been really propagated in the second wave. So it's a good idea to wear a cotton mask at the bottom and then wear an N95 on top of it. Double masking will provide you additional protection. So that's a good idea. Second very important thing is to practice hand sanitization. Frequent washing of your hands with soap and water for at least 20 seconds, or use a alcohol-based sanitizer containing at least 70% of alcohol. So hand sanitization is very important. Social distancing. Now that is something which should be practiced even at home. So, there may be some member of your family who is going out for work, office, or for the groceries, for the daily needs. Please make sure that when this person comes back, he or she is taking a bath and, taking good care of sanitization. And you being in the vulnerable, sort of population, you being the pregnant lady, you should try to maintain social distancing from this member of your family also. So all these COVID appropriate behaviors, hand sanitization, social distancing, masking, they are very important. Now coming to the pregnancy specific care in such times. So there has been an alteration when we talk about the pregnancy care. There is a limitation in accessing the healthcare facility, in accessing the ultrasound scans, and we want to minimize visits to hospital as much as is possible. And so, technology has come to rescue in a big way. We have teleconsultations, we have video consultations ongoing, and those, especially in the early pregnancy, can, get in touch with their doctor. Rather, they should get in touch with their gynecologist over a video consultation if possible. Minimize going out of the house and going in the hospital premises. So teleconsultation is another thing. And but at home one should be careful that beyond 24 weeks of pregnancy you are taking care of the baby's movements.
you are very careful about the child's movement. Monitor your BP at home. Take a electronic BP apparatus. Even if you're not able to go to the health facility, monitor your BP once or twice in a week. Monitor the weight of the mother once in 2 weeks. So these are certain basic things that a pregnant lady can do to safeguard herself in the times of COVID. Of course, teleconsultations are important because there are certain important ultrasound scans, like the level 1 scan and the level 2 scan, which are important and they shouldn't be missed. So it is important to do that. Now I see a few questions in the chat box. The first one is, does the COVID affect the baby in womb? So if a pregnant lady has got COVID infection herself, so far, whatever evidence and literature has come up, it has shown that the transmission of the virus through the mother to the baby while the baby is still inside the womb is probable. But what proportion of pregnancies will get affected and what is the significance of such an infection to the baby is still not clear. By and large, a mother having COVID herself during pregnancy, the babies born have not shown to be COVID positive. They are safe. So we are still not sure whether the vertical transmission from the mother, infected mother to the child can actually take place. Most of the reports have shown that it does not. If a lady develops COVID in early pregnancy, in the first 3 months of a pregnancy, then also it has not been seen that it leads to an increased risk of miscarriage or that it is teratogenic, meaning thereby it may lead to some malformations in the baby. So there is no definitive literature or report to support this. So far, the effects on the baby because of the mother being because of the mother getting the infection, they have not been seen so far in whatever literature we have. So the other question is कि regular checkup के लिए कितनी बारी जाना चाहिए प्रेगनेंसी में? So जैसे मैंने कहा कि अगर आपको प्रेगनेंसी में कोविड हुआ है तो प्लीज आप अपने आप को घर पे आइसोलेटेड रखें और एक कोविड केयर फिजिशियन से फोन पे बात करें. Home treatment has been very successful and it is very very useful. Home treatment से ही 90%, 95% of the cases they are taken care of. Do not visit the health facility for the benefit of people around. But of course, अगर आप ऐसा देखती हैं कि ट्रीटमेंट के बावजूद आपको फीवर सेटल नहीं हो रहा है, आपको सांस लेने में तकलीफ बनी हुई है, या आपको चेस्ट पेन चलता जा रहा है, या आपको ऑक्सीजन सैचुरेशन 95% से नीचे डिप कर रहा है, then you should tell the doctor and probably this is the time when you will need a hospital admission. So that is about this thing. Then एक किसी ने क्वेश्चन डाला था कि प्रेगनेंसी में क्या कोविड होने का चांस ज्यादा होता है. So here I would like to answer that a pregnant lady is not at a greater risk of getting a COVID infection, but because of the altered immune response of the body, अगर किसी pregnant lady को infection होता है, तो there are chances that she may have a more severe infection, that she may there may be increased requirement of oxygen supplementation or hospitalization or ICU or ventilatory support. So these things can happen with a pregnant lady. और कुछ risk factors जैसे कि COVID infection का होना in the last 3 months of the pregnancy, या फिर अगर pregnant lady is more than 35 years of age, or if she is obese, she has a BMI of more than 25, or if there are other comorbidities like she has diabetes or high blood pressure, then these things put the lady at a greater risk of having a more severe disease. Otherwise, pregnancy per se will not put you at a higher risk of getting COVID infection. So किसी ने क्वेश्चन डाला है कि my son is 2 years old and I want a second baby. So is it safe to conceive in this time? वेल ये एक बहुत पर्सनल चॉइस है वेदर यू वांट टू कंसीव इन द पैंडेमिक और नॉट. फर्स्ट थिंग इज कि यू शुड बी माइंडफुल ऑफ अ फ्यू थिंग्स, कि अगर आप प्रेग्नेंट होती हैं तो पॉसिबल है कि आप हॉस्पिटल विजिट ना कर पाए या आप अल्ट्रासाउंड उतना फ्रीक्वेंटली ना करा पाए. सो द केयर कैन बिकम लिमिटेड इफ you become pregnant in this time. The second thing is, if you have recently taken a vaccine, then after taking the vaccine, you should, postpone getting pregnant by at least 8 weeks. So it is weighing your risks and benefits. If you want to complete the vaccination schedule, then you should, wait and complete the vaccination schedule. आप कोविशील्ड लगवाते हैं तो कोविशील्ड के 2 डोजेस में अभी द टाइम इंटरवल इज 12 to 16 वीक्स, और अगर आप कोवैक्सीन लगाते हैं तो उसके 2 डोजेस में द टाइम इंटरवल इज 4 to 6 weeks. So you need this much time to complete the vaccination schedule, and after completing the vaccination you should wait for another 8 weeks and then you should plan a pregnancy. अगर आप प्रेग्नेंट हो गई हैं, बी इट प्लान्ड और बी इट अनप्लान्ड, then COVID vaccination is not to be taken during the pregnancy. ये एक और क्वेश्चन किसी ने डाला है कि कैन कोविड वैक्सीन बी टेकन ड्यूरिंग प्रेगनेंसी. सो अगर आप प्रेग्नेंट हो गई हैं तो कोविड वैक्सीन अभी तक हमारी गवर्नमेंट ने अप्रूव नहीं किया है टू बी टेकन ड्यूरिंग प्रेगनेंसी. द सिंपल रीजन बीइंग दैट इन आवर कंट्री वी हैव सो फार नॉट कंडक्टेड एनी ट्रायल्स with the Covishield and the Covaxin. So we do not have safety data for these vaccines in the pregnant women. And so pregnancy में आप वैक्सीन नहीं लगवा सकती हैं, लेकिन recently the government did give its approval for vaccination during breastfeeding. So अगर आप अपने बच्चे को दूध पिला रही हैं, then yes, you can go ahead and take the vaccine. Then it's not a problem. And so sometimes it happens that किसी ने एक वैक्सीनेशन का डोज ले लिया है and then she misses her period and she finds out that the pregnancy test is positive. So then there is another dilemma कि हमने एक डोज ले लिया है, we didn't know that we are pregnant. So अब क्या करना है? Should we take the second dose? That is the first question. तो वेल जैसा मैंने क्लियर किया कि प्रेगनेंसी के दौरान आपको सेकेंड डोज कोविड वैक्सीन का नहीं लेना है. और दूसरा सवाल ये आता है कि अनजाने में वैक्सीन लगवा लिया है तो क्या अब प्रेगनेंसी टर्मिनेट करना है? तो ये भी मैंने आपको बताया कि अभी तक हमारे पास जो भी डिलीवरीज हुए हैं उनसे ये ऐसा नहीं देखा गया है कि कोविड इन्फेक्शन से बच्चे में कोई बनावटी खराबी मिली हो. तो इसलिए अगर वैक्सीनेशन लगवा भी लिया है without knowing that there was early pregnancy, you should carry on with the pregnancy. There is no indication to terminate the pregnancy. जैसा आपके डॉक्टर बताएं, आपको अपने level 1 and level 2 scans कराने हैं and we just need to monitor the baby, but there is no indication to terminate the pregnancy. So then somebody has asked that I am nursing my 2.5-year-old child. Can I take the vaccine? Yes, very well, Neha. Please go ahead and take the vaccine. As it is, the child is 2.5 years old. I would suggest that you should stop breastfeeding the child beyond 2 years. Generally, it's a good idea to stop feeding the child. And as it is, the vaccine is now approved during breastfeeding. So there is no problem. Please go ahead and take the vaccine. So then somebody is asking me, क्या प्रेगनेंसी में abdominal pain होना नॉर्मल है? So प्रेगनेंसी में वेग पेन पेट के निचले हिस्से में हो सकता है, लेकिन प्रेगनेंसी में कुछ रेड फ्लैग्स होते हैं जो मैं आपको बताना चाहती हूँ. अर्ली प्रेगनेंसी में अगर आपको पेन है पेट के नीचे हिस्से में और अगर उसके साथ कोई ब्लीडिंग या स्पॉटिंग होती है, देन यू मस्ट टेल योर डॉक्टर. If in early pregnancy you feel any episode of fainting या आपको चक्कर से आते हैं या आप light headed महसूस करती हैं, then again you should be telling your doctor. At any point of pregnancy, if you feel that you are having any vaginal discharge which is foul smelling or which is associated with itching, तो भी आपको डॉक्टर को बताना है. एंड इन द सेकेंड हाफ ऑफ प्रेगनेंसी अगर कभी आपको बेबी के मूवमेंट्स ना महसूस हो फॉर 4 आवर्स, या फिर आपको इंटरमिटेंट यानी रुक रुक के मरोड़े जैसा दर्द पेट के निचले हिस्से में महसूस हो, या फिर आपको ब्लीडिंग हो, या वजाइनल डिस्चार्ज हो, या आपको पानी छूटे यानी वाटरी डिस्चार्ज हो, then these are all red flags. You know, कोविड के समय में आप हो सकता है अपने डॉक्टर से बहुत रेगुलरली मिलने ना जा पाए, लेकिन यदि इनमें से कोई भी परेशानी आपको घर में होती है तो आप प्लीज अपने डॉक्टर के संपर्क में आए, उनसे डिस्कस करें, एंड शी मे टेल यू टू गो टू द हॉस्पिटल एंड गेट योरसेल्फ एग्जामिन्ड. So that was that. Then the next question is it having any side effects, the COVID vaccine? So कोविड वैक्सीन के बाद कुछ लोगों को, इनफैक्ट काफी लोगों को देखा गया है कि दे में डेवलप फीवर के साथ शिवरिंग यानी ठंड लग सकती है, बॉडी एक्स हो सकते हैं, सम पीपल में डेवलप हेडेक, some people are even experiencing a rising blood pressure. So all these symptoms are coming up with the COVID vaccination. There can be pain in the arm, there can be a local redness at the site of injection, but most of the times these side effects are self-limiting. They are they resolve on their own over a period of 24 to 48 hours. You may need to take 2-3 doses of crocin to take care of these side effects, but beyond 48 hours these side effects, they totally subside. So the vaccine is largely very safe. Please do not have any doubts in your mind. आई थिंक अभी तक हमारे देश में 22 करोड़ से भी ज्यादा वैक्सीन डोजेस लगाए जा चुके हैं. And considering how lethal the COVID infection in the second wave is proving to be, it is in everybody's interest that you go ahead and take your vaccinations. I urge everyone to go and please take the vaccinations. And so then, Neha Sharma, she's asking me that the baby is not stopping feeding even though he is more than 2 years old. So what is the way to make him understand? So Neha, कोई जादुई नुस्खा यहाँ नहीं होता है. All you have to do is be very firm that you're not going to feed your child. The child will cry for 2 days, 3 days, 7 days. But believe me that children have a very, very short-term memory. आपको ऐसा लगता है that he is so used to it, but 1 week he does not have your milk and he'll totally forget about it. And so that's the only way to stop breastfeeding the child. And so then there is another question that my friend is pregnant and she got COVID, then she was negative. Does this have any effect on the delivery and is it necessary to get a cesarean section? So Nikita, here I would like to tell you that there is no literature, there's not much literature. We are still learning about the disease. But in our experience, what we have seen is that if a lady develops mild COVID in early pregnancy, say the first 3 months or in the 4th, 5th month, then, we are seeing certain complications come up in the later part of pregnancy. So sometimes these babies जिनके माँ को COVID हुआ है pregnancy में, ऐसा हम देख रहे हैं कि कुछ बच्चे जो हैं इनमें दे डेवलप ग्रोथ रिस्ट्रिक्शन, यानी कि उनका वजन जितना होना चाहिए उतना नहीं हो पाता है और वो बच्चे थोड़ा सा कमजोर रह जाते हैं, या फिर बच्चे के आसपास जो पानी होता है वो पानी की मात्रा अचानक से कम हो जाती है. सो इस तरह के कुछ कॉम्प्लिकेशंस बिकॉज ऑफ कोविड इन प्रेगनेंसी हमें ये सेकेंड वेव में देखने को मिले हैं. और एक चीज जो बहुत प्रोमिनेंस में आई है वो है प्री टर्म डिलीवरी. प्री टर्म डिलीवरी होना मतलब अपना समय से पहले डिलीवरी हो जाना, 37 कंप्लीटेड वीक से पहले ही डिलीवरी हो जाना. सो द इंसिडेंस और द रेट ऑफ प्री टर्म डिलीवरी हैज इंक्रीज्ड विद कोविड इन प्रेगनेंसी. जो नॉर्मली प्री टर्म डिलीवरी का रेट अराउंड 8% होता है, दैट मीन्स 8 out of 100 women will go into preterm labor. We are seeing that in the pandemic, in women who had COVID infection, the rate has increased to almost 20%. So that's a high incidence of preterm delivery, and that is one effect that we all are observing. Now regarding the mode of delivery, COVID infection होने का मतलब ये बिल्कुल नहीं है that it is necessary to go ahead with a cesarean section. A normal delivery could also be done in a COVID positive mother. डिलीवरी का टाइमिंग क्या होगा और उसका मोड क्या होगा, सिजेरियन है या नॉर्मल डिलीवरी है, दिस इज कंप्लीटली द डिस्क्रिशन ऑफ द ऑब्स्टेट्रिशियन, depending upon the clinical situation, the condition of the mother, the baby, the labor progress, the obstetrician takes a call whether to do a cesarean or to do a normal delivery. So that I hope answers your question, Nikita. Then Aman is asking me कितनी बार cesarean करवाना चाहिए during pregnancy, scan कराना चाहिए during pregnancy. So well, Aman, there are first 3 scans तो ऐसे हैं जो जरूर होते हैं प्रेगनेंसी में. पहला स्कैन जो होता है वो यूजुअली 6-7 हफ्ते के आसपास किया जाता है टू कंफर्म द प्रेगनेंसी, टू नो द एग्जैक्ट ड्यूरेशन ऑफ प्रेगनेंसी, टू कंफर्म द प्रेजेंस ऑफ हार्ट एक्टिविटी इन द प्रेगनेंसी. देन देयर इज अ लेवल 1 स्कैन जो कि 11 से 13 हफ्ते के बीच में किया जाता है, एंड द पर्पस ऑफ दैट स्कैन इज टू डू अ जेनेटिक स्क्रीनिंग ऑफ द चाइल्ड. एंड देन द थर्ड स्कैन which is the level 2 scan, which is done around 18 to 20 weeks of pregnancy, is a very detailed scan जिसमें बच्चे की बनावट को स्टडी किया जाता है कि बच्चे में कोई बनावटी खराबी तो नहीं है. So these 3 are they are the mandatory scans, if I can use that word. And then later on in the pregnancy, बच्चे की ग्रोथ वगैरह को असेस करने के लिए क्लिनिकल जजमेंट के हिसाब से the obstetrician decides when the next scan would be required. So Aman, I hope that answers your question. Then Neelam is asking me what type of vaccines are good and when will government allow vaccination for pregnant women. So well Neelam, जो हमारी FOGSI यानी कि जो हमारी इंडिया की ऑब्स एंड गायनी सोसाइटी है, they have been really trying their best to convince the government that the pregnant population is a very vulnerable population and they must get the benefits of the vaccine. वैसे भी यूएस में और यूके में the Moderna and the Pfizer vaccines that they are using, they have been giving to all of their pregnant women also. But India में we are not using those vaccines. We are using either the Covishield or the Covaxin. And so इन vaccines के साथ pregnant ladies में कोई trials अभी तक नहीं हो पाए हैं, and we do not have the safety data. And because of that, the government is taking some time to make that decision. But like they have given a go ahead for breastfeeding women, I think in the near future it may get approved for pregnancy as well. But for the current time, as of today, it is not to be given to the pregnant patient in our country, right? So the next question is by Ayushi, that प्रेगनेंसी में वैक्सीनेशन करवाने से बेबी को कोई प्रॉब्लम तो नहीं होगी. So Ayushi, here I would like to tell you कि प्रेगनेंसी में तो कोविड का वैक्सीनेशन अलाउड ही नहीं है, लेकिन अगर गलती से आपने एक डोज ले भी लिया है वैक्सीनेशन का, यू डिडंट नो दैट यू आर प्रेग्नेंट एंड आपने ले लिया है, तो बाय एंड लार्ज आई मीन 99% द बेबी इज नॉट गोइंग टू हैव एनी प्रॉब्लम. जैसे मैंने कहा, द रिक्वायर्ड स्कैन्स, द लेवल 1 स्कैन, 2 स्कैन, they'll be done. But so far, whatever data we have, it does not tell us that the COVID virus or the vaccination can lead to problems with the baby. All right. So Ruchi is asking me if is there any chance of pregnancy if periods are not coming and the age is 39 years? So Ruchi, I think you need to get yourself evaluated. You must consult a gynecologist. You will need to undergo certain tests, physical examination, and on the basis of your reports, she'll be able to answer your question, whether pregnancy is a possibility for you or not. Then the next question is, what are the precautions one has to take after vaccination in pregnancy? So again, I would like to say here that vaccination pregnancy में नहीं लगवाना है, लेकिन हाँ, there is a flu vaccine available, right? we cannot give COVID vaccination in pregnancy, but we can give the flu vaccine. Even before the COVID pandemic, we were always advocating that pregnant women should take the flu vaccine. So, flu vaccine pregnancy के किसी भी समय पे first, second या third trimester में दी जा सकती है. It can be taken at any time of the pregnancy, and it, the data has shown that taking the flu jab also will reduce your chances of getting COVID infection by as much as 24%. So definitely it gives some protection against the COVID-19 virus. And I would tell all pregnant women to go ahead and take the flu shot. COVID vaccine still not to be taken during pregnancy. So then somebody is asking me, can COVID vaccine affect the future pregnancy? I don't think so. So I don't think that taking the vaccination will have any bearing on your fertility or of a pregnancy in future. It is very safe. Then here itself I would like to clarify that there were some rounds going on that the vaccination and menstruation. सो मेंस्ट्रुएशन की फिजियोलॉजी का वैक्सीनेशन से कोई लेना देना नहीं है. ऐसा नहीं है कि आप पीरियड्स के दौरान वैक्सीनेशन नहीं ले सकती. यू मे बी ऑन एनी डे ऑफ योर पीरियड, it does not matter. You can go ahead and take the vaccination at any point of time in your menstrual cycle. So please be clear about that. Then can an infected mother give skin to skin contact to the baby? This is a very very relevant question. एक कोविड पॉजिटिव लेडी जब बच्चे को जन्म देती है तो क्या वो बच्चे को अपने पास रख सकती है? सो ये एक शेयर्ड डिसीजन मेकिंग होता है बिटवीन द गायनेकोलॉजिस्ट, द पेडियाट्रिशियन एंड द पेशेंट हरसेल्फ. दे हैव टू मेक एन इन्फॉर्म्ड चॉइस कि आप बच्चे को अपने साथ रखना चाहते हैं, ब्रेस्ट फीड करना चाहते हैं, या यू वांट टू सेपरेट द बेबी फॉर द ड्यूरेशन ऑफ इन्फेक्टिविटी which is 14 days. By and large, because of the limitation of resources, space, and the benefits that the breastfeeding offers, we encourage that even a COVID positive lady breastfeeds her child. जरूरी है लेकिन कि ब्रेस्ट फीड करते हुए वो मास्क पहने लेडी और अपने हाथों को प्रॉपर्ली सैनिटाइज करके ही बच्चे को ब्रेस्ट फीड करे. जैसे ही फीडिंग खत्म होती है, द चाइल्ड कैन बी kept at least 6 feet away from the mother, even if they are in the same room. That distance between the mother and the baby can be maintained. So this can be practiced for some time, and if the lady feels that she does not want to directly breastfeed her child because of the infection, then she can actually express her breast milk, and this expressed breast milk can be given to the child by by a healthy caregiver. So that is also one possibility. But yes, बच्चे को साथ रखना है या सेपरेट रखना है. सेपरेट रखना would be ideal to reduce the chances of infection to the child. But if because of the limitation of resources or because of the mother's choice, we are rooming in the mother and the baby, then these precautions can be followed. So I think we are coming to the end of this session. We just have a couple of minutes more. So there's a question come up that how many chances are there that COVID infected mother will have infected or her normal baby? I think whatever data we have, most of the times, 99% of the times, the child is healthy. COVID infected mother की जब delivery होती है, बच्चे का COVID test किया जाता है 24 hours, and then the test is repeated after another 24 hours. So and most of the times the child is found not to be infected. कोविड इन्फेक्टेड मदर का जो एमनियोटिक फ्लूइड है, प्लेसेंटा है, वजाइनल सिक्रीशंस हैं या ब्रेस्ट मिल्क है, दे हैव एक्चुअली नेवर टेस्टेड पॉजिटिव फॉर द कोविड वायरस. सो अगर पैदा होने के बाद बच्चे को कोविड होता भी है तो चांसेस ये है ज्यादा कि बिकॉज ऑफ द पर्सन टू पर्सन कॉन्टैक्ट बच्चे को कोविड हुआ है, rather than it being transmitted to the child in the womb or during the process of delivery. So I think we are coming to the end of this session, and I hope I have been able to address most of the questions, and I hope that the audience has found this session to be interactive and useful. You may get in touch with me through the hospital help desk if there are any further queries on this topic. So stay safe, everyone. Stay home, stay healthy. Bye-bye and take care. Bye.